I'm Dr. Vikram Jain. Today's topic, in continuation of what we did from the past 2 months, is on fibromyalgia. We discussed what is fibromyalgia. Then we had discussion about the role of mental health, anxiety, and depression with fibromyalgia. Now, moving on to a third episode, and we're going to discuss the role of physiotherapy in fibromyalgia. Fibromyalgia, as we all know, is affecting millions of people worldwide, and it causes widespread pains, disturbed sleep, fatigue, and affects the quality of life. The treatment of fibromyalgia is not only medication but also physical therapy. And to discuss the role of physiotherapy in fibromyalgia, we have a very experienced and eminent physiotherapist, Dr. Shivraj. Welcome, Dr. Shivraj, who will help us to discuss the bring out the aspects of physical therapy in fibromyalgia. So today, without wasting much time, I will like to start our discussion on fibromyalgia. Uh, Dr. Shivraj, as fibromyalgia, we have been discussing past 2 months.
Yes.
Medication is has a role which we, as rheumatologists and other specialists, also suggest. But we know medication has a very is just one part of the therapy. Physical
Yeah.
therapy is also a major aspect of fibromyalgia. That is why the treatment of fibromyalgia is more of a team effort. Now, where
Yes.
does physiotherapy fit in this treatment of fibromyalgia? What is the role of physiotherapy in fibromyalgia, and can it really help reduce pain?
Yeah. So, everybody, good evening. I'm Dr. Shivraj, working as a physiotherapist, consultant physiotherapist at Optima Hospital. So, yeah, Vikram sir. So, your question is, yeah. So, physiotherapy is one of the widely used treatment for the fibromyalgia. In previous few episodes, we already discussed what is fibromyalgia and how to manage it. With multiple modes of treatments. So, physiotherapy basically, I can say, is one of the best non-pharmacological management for the fibromyalgia because exercises not only works or reduce your pain, it will improve your all over functional abilities, your day to day work. you know so fibromyalgia make you fatigue. Main thing is you are not having proper sleep, so that will change your multiple uh, things in your day, your activity levels, your performance, your breathing here and there. So many things, so many aspects are there under physiotherapy as well, and we have to address each and every, and we have to work accordingly. So basically, any patients who comes with fibromyalgia to us, they'll ask multiple questions. This much of pain is there, or how will if we are doing or trying little bit of exercise also, it is not giving any relief. So we'll dig deeper in this question, that how exercises will help in particular fibromyalgia, and we'll definitely try to explain from our side that how exercises will definitely give so many good results in fibromyalgia conditions.
Sure. So we understand that fibromyalgia treatment, the apart from medication, physiotherapy is a major aspect, and it can help reduce the pain, which is the major problem in patients with fibromyalgia.
Yeah.
But one aspect is many patients complain that when they start doing exercise, they want to do exercise, but when they start doing
Yes.
exercise, they feel that actually makes their pain worse. Uh, Instead of helping their pain, it worsens their pain. So how can they start exercising safely in fibromyalgia?
Yeah. So this kind of sentences comes who, like, lot of fibromyalgia patients starts doing exercises, but not in a structured manner. So if somebody is telling you you have to do exercises that will reduce your pain and stuff, so they'll find out few videos or some list of exercises they'll get, and they'll start randomly some exercise at their home, some stretches, some mobility, and some strength related exercises. But eventually, what it does is, fibromyalgia is widespread multiple system condition. You have to assess your neural system, because mainly your sensitization towards the pain is increasing, right? So neural system we have to check. We have to check your breathing, because oxygen levels affects a lot of muscular performance as well. Your daily activities needs a lot of oxygen. So those things, then we have to check your pain levels. So pain is also one of the things we have to completely separate. We have to keep completely separate, like as I told or mentioned, breathing. So pain is also one of the pillar where we have to work extensively, because patients will feel throughout the day pain. Any lighter activities also will give them pain, and those kind of constant pains will develop fear about movements. So there is a word which is called kinesiophobia, so which basically comes in fibromyalgia patients, because they are having a lot of pain in the muscles. They are not willing to move their limbs. They doesn't like to move it too much because of a lot of pain. So those kind of things we have to address. We have to work on multiple system, as I told. So particular pain, how will work on the pain? So as I mentioned, people starts random programs and videos and stuff. But for that, if you are meeting physiotherapists, taking a consultation, then they'll definitely help you with your pain patterns, when it is coming, who is, like, which kind of things are aggravating it, which kind of factors are reducing or relieving it. So all the pain history we have to take, from how long it is, how chronic, how acute it is, so on, depending all this kind of assessments will come on the conclusion which kind of intensity of the exercise will be prescribed from our side. So exercise prescription will be according to your present condition, present assessment of the condition, and accordingly we'll take a call regarding intensity of the exercise, which will not give you pain on the day one. Because there is a word which is called boom and burst. So suppose you start very enthusiastic that I'll start exercises, my pain will come down. It doesn't happen like that. So boom and bust means on day one you will start so much, 8, 5, 10 exercises, and next day you will tell, my pain has increased. So that pain also stays for few days, because your muscles are already little sensitive and your nerves are sensitive. So it will keep giving you pain, because you put lot of load on the muscle directly in shorter period of time. So if you are assessing it, if you know the condition better, then we'll definitely put one structured program accordingly. And if you are following that, you'll definitely not feel that kind of painful episodes for sure.
Thank you, Dr. Shiraj. Three keywords I understood. One is it has to be structured, the intensity has to be gradually decided, and the boom and burst.
Yes.
So these are the keywords. So patient with fibromyalgia, it's important that you have a structured program, just not a random exercise, and they have to not jump into directly doing excessive exercise. They'll have to take it very slowly. The intensity has to be decided based on your pain level and the duration of your fibromyalgia. So we talked about, yes, there's a role we need to do in a structured way, but which type of exercises are best for fibromyalgia? Is it stretching? Is it strength training? Is it aerobic exercise? Is people do yoga, aquatic therapy? There's so many people have different type of exercises people have recommended. What do you suggest is the best exercise for fibromyalgia?
So according to our treatment protocols, or patients comes to us with fibromyalgia, we are digging deep down in the pain histories, and accordingly we'll make our exercise programs. But according to, if you see strong research uh, levels also, which is done on exercises and other treatment areas, as you mentioned, yoga and aerobic exercises and aquatic therapy. And so basically all these things are part of physiotherapy only. If you take aquatic therapy or aerobic exercises, they are just different branches of physiotherapy, where aerobic exercise will help you to improve your breathing capacity and makes your breathing proper, which will leads proper oxygen supply to the muscles. And now aquatic therapy is exercises which we are doing in the pools. So if in any severe conditions, patients are not able to move, as I mentioned, because of kinesiophobia or fear of movement, patients will not choose to move, and eventually their muscles will decondition and they'll have a lot of weakness in their body. If they'll move a bit also, it will be very painful for them. So aquatic therapy provides a lot of good resistance because water have its natural resistance. So those kind of exercises, aquatic therapy, will definitely help them to be little confidence against the movement, and they'll get some confidence that movements are not bad, and eventually that nervous systems which is extra sensitized will reduce its sensitivity towards the movements, and eventually your movements become pain free. One of the most important out of all these therapies, exercise therapy is, if you are doing it structure and gradually if you start, this is one of the best evidence according to research that apart from any non pharmacological treatment therapies, physiotherapy is one of the best to manage your fibromyalgia if it is well structured and gradual. So first is exercise. Second thing you can try is, like as I mentioned, aerobic exercises. There are breathing exercises, a part of physiotherapy only. So we can include in our exercise program also one or two exercises which will improve your aerobic capacity or stuff, like 6 minutes walk test, 2 minute walk test, depending your ability to take it. Aquatic therapy, there anyways, as I told, water have its own resistance, so we can mix that also if patients are severely affected, because this kind of yoga definitely improves your breathing and your mobility of the muscles. So eventually that will also reduce a lot of load on the muscles, and muscle will get a little bit of recovery. So medications, yoga, this kind of stuff, which is more relaxation kind of techniques, and improves your breathing. So definitely those things are also giving good results. Strength training particularly, so strength training is a thing where you have to lift weight or some body weight exercises which will put a lot of load on the muscle. So strength exercises, if it is well planned, that will give you one of the best results according to, in your daily activities, whatever activities you are doing, your posture maintenance capability or endurance of the holding one's particular position will improve, your energy levels will change, and that will change your productivity throughout the day. So strength training, how will start strength training? If you have fibromyalgia, if you are coming to us, we'll assess you, will make your exercise program accordingly. So initially, if you are having a lot of pain, then we'll go gradually. Week one will be focused more towards breathing capacity, your sleep patterns improvement, your food habits. So all this education related to how to reduce sensitivity of your nerve, and reduce some pain by working on those things will definitely help. And strength training is very huge part with, because like progression wise, if you take, it will take from few weeks to few months, and that will be little gradual. So initially relaxations and light movements, active passive movements, we can start slowly. After 3 4 weeks, if a little bit of tolerance, exercise tolerance is developed, then we can move forward with introduction of little bit of external resistance, which is like resistance band and some kind of dumbbells, kettlebells and stuff. So those kind of, or we can go with the body weight exercises as well, because most of patients will not be able to have that kind of facilities where somebody can help, or equipments also they don't have. So body weight exercises also you can start, which is very safer, and it will give you a lot more and more confidence towards the movements. So more you move, more your body will know that these movements are safer. I'm not having that much of pain. So gradually, if you'll start with few degrees, if it is becoming pain free, your body will automatically allow you to go in the new ranges. So that's how that progression of exercises is very important. Okay, so it will give your body time to heal, as well as it will make you stronger from in to out. Yeah.
Sure. Thank you, Dr. Shivraj, for bringing that out very clearly. So it has to be a very gradual process where we ease into the exercise from very mild to more and more exercises. But how much exercise is enough? Is there an ideal duration the people with fibromyalgia or ideal frequency they should be doing, say, so many days a week or so much time during a day, which is good for patients with fibromyalgia?
Yeah, so there is not any fixed numbers of hours or minutes or day per week you have to do exercises, but according to what our exercise tolerance, which is, it comes with a lot of patients prescriptions, that it will give you automatic ideas how to prescribe particular dose of the exercise, and of course the assessment things. So most of the patients will be able to tolerate around 2 to 3 days per week of exercise. Okay, so that will be the ideal intensity of the exercise in a week, which is 7 days. You can easily go for 3 to 4 days of mild to moderate exercise to start with, and slowly you can increase your timings according to your exercise tolerance is developing with the ongoing sessions. So by end of 3 to 4 weeks, you might reach around 40 to 45 minutes a day. That kind of around 2 to 3 sessions a week will give you enough muscle activations as well as mobility and flexibility in the joints, as well as it will give you, good amount of energy, and it will give you 1 day recovery period also, because 3 days, which is alternate days in a week, 1 day you are doing exercises, 1 day you are taking some rest, so your body will, recover also from those exercise strains. So that way we can set the frequency also around, for 2 3 sets uh, later on, but we'll start with one set of 15 repetitions, then we'll move forward with, next, or if you are tolerating well, then next week will be 2 sets of 15 repetitions on each side, those kind of progressions. So there are multiple variables. If you see, there is a frequency, how many sets you have to do in a particular session, and how many sessions you have to do in a week. So frequency is how many repetitions of particular exercise you are doing in a session, and the intensity of the exercise is also, we can measure, how much weight you are putting. Okay, so those kind of alterations every week. One week you are increasing frequency, one week you are increasing resistance or the intensity of the exercises. But ideal amount of the exercise would, we would prescribe our patients is 2 to 3 days per week, and that will give optimal recovery time as well as nice pain
Yes.
free recovery.
Absolutely. So 2 to 3 times a week, so that there's adequate rest time in between to allow for recovery, is would be an ideal frequency for patients with fibromyalgia. But while doing exercise, as we discussed initially, patient starts experiencing pain has increased. So should they stop at that time or they modify the routine? What would be your suggestion if a patient you are suggesting fibromyalgia starts having increased pain?
So, flare ups in the fibromyalgia is very common. It is not like once you got flare up, you start, getting panicked and you're not doing any exercises. You stop doing exercises and stuff. So, flare up is very common part of the fibromyalgia because your nerves are extra sensitive. If your muscle is getting little bit of load here and there, if your form is wrong in the exercises, that might lead some kind of muscles or, stimulate different areas, then it will give you or increase the pain. So if your severity of fibromyalgia is little high, you have a lot of uh, trigger points in particular area, and if you are doing exercise for that area, then definitely next day, anyways, we'll let the patient know, or we'll educate enough our patients that they will definitely know next day what is gonna happen. It's not like pain is increasing means you are not recovering, you are not stepping forward. It is just a part of the recovery process. If your muscles are loaded, it is kind of little bit of soreness. So if you are completely fit, you are joining the gym, suddenly you are doing one day exercises, next day you will develop a little bit of soreness. So that is part of the recovery. In fibromyalgia also, because your muscles are so weak, it will get damage also a little easier. So lightweight exercises also will definitely give similar effect. If you are having fibromyalgia, it will give you similar effect, you are doing some heavyweight training. Okay, so those kind of things are very common. Flare-ups can come and go, but it should not hamper your recovery process at all. And you should continue moving, aerobic exercises, which is cycling, running, jogging, walking, any kind of activities you can do, you should continue that. So your muscles, whatever recovery you have got, whatever strength you have developed, it should not get deconditioned. So that deconditioning, if you're taking long breaks from the exercises, the deconditioning of the muscle will happen.
Perfect. So, Dr. Shivraj, apart from the usual physical therapy, we discuss about aerobic, stretching, strengthening, aquatic therapy, other modalities like TENS or dry needling, are they also beneficial for patients with fibromyalgia? Do you offer these modalities also to your patients with fibromyalgia?
So TENS is one of the therapy which modulate your pain. So basically, it is nerve related, conduction related pain. So TENS might help. That is very good electrical modality, and good research happens on that particularly. But if you see other treatments like dry needling, exercises, yoga, and like other things. So dry needling is also one of the acupuncture things which will work on your trigger points. So in fibromyalgia, you will develop a lot of trigger points. So trigger point is basically a tender area where you will have maximum pain. You develop muscle knots. In generic terms, we tell. Okay, so those kind of knots will get a little bit of relief with the dry needling. Tapping is also one of the good alternative, which includes in physiotherapy. The tapping will support your muscle energy systems, and it will give some relaxation to the particular area where you have a lot of pain or a lot of suffering. So those kind of treatment
Can also
protocols
use.
or treatment modalities you can use.
Yes. Absolutely. So, yeah. So when you start treatment with physiotherapy for patients with fibromyalgia, what do you feel is the common mistakes people make when they are trying to become physical active? Do they try to do it very quickly? Do they want to overexert themselves, or they take it very slowly? What is the common issues or common mistakes people make when they're doing physiotherapy in fibromyalgia?
So physiotherapy, as I mentioned one word, boom and bust. Those kind of, already we have discussed few of things, but still I'll put some light on those things so it will give better idea what kind of mistakes you should avoid. So most of the people are doing mistakes by skipping exercises, as we discussed earlier. That initial exercises will give you a lot of pain and kind of stuff. So if it will be structured, that kind of thing will not happen. But if it is not structured, you are doing random exercises, it 100% gonna increase your pain. So those kind of mistakes you should not do. You should consult a physiotherapist, and if you're comfortable to do those exercises to the center or at your home, you can take according home plans and stuff. And second mistakes people are doing is leaving the exercise in between. So few weeks of exercises will give you little bit of improvements, but if you are getting demotivated that when this will happen, then those kind of things will not fall in a line, because fibromyalgia is including multiple systems. We have to work on multiple things, your muscles, your joints. It is not involving directly, but indirectly your muscles and joints will be involved because of lot of pain. So to regain your mobility, to regain your strength, because strength gains also in the muscle will take minimum 4 to 6 weeks. So those kind of recovery durations will be longer to see you or give you some visible results in fibromyalgia particularly. But it is definitely, if you are following it continuously, regularly, with structure, 100% you are going to get good results with those kind of things.
That's a very important point you have brought out, Dr. Shivraj, that it's important that it should be under an expert who knows how to manage, how to structure the exercise. It's not any random exercise. It has to
Yes,
be
yes.
structured and depend. The intensity varies. So
Yeah.
some expert has to look into it. So please try to meet a physiotherapist and try to take their opinion, and under their supervision and guidance, that would be the best way to proceed with the exercises in fibromyalgia. So the last but one question is, any some patient say has fibromyalgia from past 10-15 years, is a 60-year-old lady, absolutely
Mm.
deconditioned, has not done any exercise because of pain, sleep is affected, mood is affected,
Mm.
is, as you said, kinesiophobia, doesn't want to move itself. Uh,
Mhm.
Pain on multiple medication, also anxious, depressed. Very common scenario with fibromyalgia. Uh, will such a deconditioned patient also still benefit from physiotherapy? How would you approach such a patient with fibromyalgia?
Very good question, sir. So most of the fibromyalgia patients are females. Okay, so percentage of fibromyalgia happening in the female is more than the males. So if those kind of patients, which is 60, 65 years of age, they are reached at mid activities levels, they are not doing that intensity of work or that kind of work, it is almost retirement age as we count according to government age and stuff. So their activity levels are not that high. They'll do one or two works here and there. And as I have seen multiple patients have similar histories, because fibromyalgia is anyways one of the main contribution is from the stress, chronic stress. So if they, yeah, they are not finding any purpose in any particular activities, they'll become little demotivated. They'll sit most of the time, they'll see the TV or stuff or here and there. They're just passing their time while doing non-interested things, because they don't have any purpose. So this kind of repeated cycles will demotivate them and they'll stop doing anything. So that will creating lot of stress on the muscles as well as in the your brain also, that I'm not finding any purpose, what should I do? So this is the one of the main reason which is giving stress to this particular age group, because I have seen multiple patients in this age group. Okay, so this kind of stressful conditions, they're living from few years, and eventually their muscles will start deconditioned, and they're living in their home, they're not able to, or they don't want to go out, because a lot of deconditioning is happened, they'll start losing their balance also sometimes. So 60 to 70 years of age is, they left their work and now they have to settle in retired phase of life, where they doesn't have any purpose to do kind. So this is my particular theory or things which I'm getting from my patients, which is like one of the repeated things. So I'll definitely try my best to explain them. Main thing is education, how you are educating your patient. So if patient knows this kind of things is happening with me, they'll start finding some purpose or some activities, maybe some painting or walking or going out here and there kind of. So those will motivate them and that will give them confidence, so that whatever deconditioning happening because of inactivity, that 5, 10, 15, 20% will reduce from there. Little bit of physical activities in terms of exercises and stuff. So if you work on particular areas, that will contribute, like sleep, your food, your exercise. If you're maintaining 2 3 things well, which is taking around few hours of that daily life, rest of the time will be pain free and not that much of stressful for them, if you are properly educating patients regarding how to live your retirement life, particularly in big cities.
Sure.
So that is from my side, my
Perfect. Yeah.
points which I want to share with the.
I completely agree. Education is the number one thing. Before we start any treatment for fibromyalgia, we have to explain. And that is a very, very important aspect of the treatment, make the patient understand. In fact, that is also part of something called as cognitive behavioral therapy, where we make them understand what is happening, that their pain is real and they are suffering from this disease, and we have ways to manage and overcome this pain. And that really is important to motivate patients to start, because in India, treatment for a patient is medication. So when you say exercise, they always see that this is not part of treatment. It is an important, very, very important aspect of treatment. So before we end, we have a few questions, Dr. Shivraj. I think we have answered many
Yes.
of them, but there are some very interesting ones. What any emerging technologies like wearable sensors, virtual reality, AI-assisted rehabilitation, telephysiotherapy? I think because AI is everywhere, so
Mm.
any way where probably has it shown helpful or promise in fibromyalgia care? Has it? Do you use any support from AI in any way for patients with physiotherapy in general or in patients with fibromyalgia? This is just probably
So
out of the box. Yeah.
no worries. So, AI or any kind of easy available information. So there are good things also, there are bad things also. So which I am sharing according to my experience, what I am looking or what I am thinking, what AI can help or AI can put impact in a health related areas. So if you developing any kind of pains, you will directly go to Chat GPT before the doctor nowadays. So, anyways, ChatGPT will or any kind of AI machines will have enough information to give particular random answers to you. So you'll start believing, you follow the strings, will keep going there. You again, this is weeks and months of process. You will keep putting those kind of strings that I'm having this pain, that pain. So it will develop one history. Now, out of the box, if you suddenly develop anything, it will get confused, interrelate everything, and it will start giving you answer accordingly because your previous history, whatever you are. So those kind of things are not good. Whatever particular problems if you are having, you definitely consult a doctor. That because a lot of instrument tools will be there which patients are not able to, or AI won't be able to give you, or you won't be able to take from AI. For that, you need some help from experienced doctors or any particular in the field of healthcare, which guide you according to your particular symptom. It's not one headache can come from 100 different reasons. So any kind of pain will also comes from multiple structures which you don't know. So if you don't know, don't go to shortcuts. Try to consult proper doctors and take proper guided medications or treatment, and that will give you and keeps you away from lot of internal doubts. Because if you'll keep asking questions to a robot, which is basically AI, you will not feel any satisfactory answers from their side, because you'll keep still thinking that if I'll found this, because they have 100 solutions, they'll give one single answer from multiple articles and multiple stuff. So you won't be able to catch up there. You'll keep getting confused and keep getting developing health anxiety stuff. If I'll have this, if I'll have that. So if you are wearing wearables and using AI also, if you'll keep looking those readings or those kind of stuffs uh, as a part that it is affecting your life that much, it is not going to help you. It will create more and more anxiety towards your health, and it will make you a little more sicker than the better. So over information is there, wrong information is there. So you have to be wise to pick up proper advices from AI or any kind of social medias.
Yes.
And yeah,
Yes.
this is from my
Perfect. I
side.
think we have shooted our time. That's why we probably end on this note. So AI is everywhere, but I think Dr. Shivraj rightly pointed out that we have to be very wise when using it, and you have to meet the right person, right doctor before jumping into AI. So I think there are a lot more questions, but we will, for the want of time, we will, and many of them we have already answered in different questions. So we would end our talk on this. Thank you, Dr. Shivraj, for taking time out and explaining about the role of physiotherapy in fibromyalgia. I hope our patients understood the importance of physiotherapy and importance of meeting the physiotherapy for structuring their exercise and deciding the intensity. Thank you so much for joining
Definitely.
once again.
Thank you
Uh,
so much, sir.
Thank you.
And thank you so much for,
Have a nice night. Good night, everyone. Bye bye.
yeah, bye. Good night.